Thank you. It's really quite a pleasure for us to be here, Dr. Michelle Cole and myself. Among so many distinguished speakers, we're really quite pleased to be invited by DCI to be here today. So we were asked to just say a little bit about why we were interested in coming. And I have been an examiner, medical examiner for women and children who've been physically and sexually abused for many years, have gone also to Honduras. We are also working through Sacred Heart University, taking care of families, children in not only Guatemala, but Jamaica, the Dominican Republic, and we are currently moving our efforts in Ghana as well. So I will let Dr. Cole speak a little bit about herself as well.
So good afternoon, everyone. So my name is Dr. Michelle Cole, and I do work with Julie Stewart at Sacred Heart University. And some of our initiatives are from the global perspective, and the one that we're speaking on today is of Guatemala. My experiences are I am a pediatric nurse that's my primary specialty, my deep affection for children and their well-being and their health, and also looking at it from a perspective of public health. So we hope you enjoy our presentation today.
One of the things that we've spoken about, and you've heard already people speaking about, is service learning. And at Sacred Heart University in our College of Nursing, it is something that we're very involved with. So it's a structured learning experience that combines community service with explicit learning experiences, preparation, and very importantly, reflection. So we really do encourage our students and push them to do a lot of reflection on whatever mission trip that they go on. The mission trip to Guatemala has been going on for about 7 years now, and it has grown over all those 7 years, starting out from some nursing students and family nurse practitioner students, and now we have as well doctoral students who come to do larger community-based programs and initiatives working with the local leaders. We have students from our speech and language department come, physical therapy, occupational therapy, and of course the faculty from these programs. These are some pictures. These are some of the children that I've cared for when I was down there. And as you well know, if you know anything about many countries, and in particular Guatemala, it's often the 8, 9, 10-year-old daughter or sister who cares for the younger children and who brings them to the clinics as well as various other places. What you see on the left-hand side of your screen are some of our students working. Those are doctoral students and undergrad students and nurse practitioner students who are working separating, it looks like a whole bunch of vitamins there because we're very adamant that we're giving our children vitamins as well as giving the prenatal patients prenatal vitamins, and that is some of the work that we do while we're preparing. So a little bit about Guatemala. The land and the people. There's really two distinct cultures in Guatemala. It's the dominant culture of the Ladino and the abiding culture of the Mayan. Guatemala ranks as one of the poorest countries in the world. More than 50% of the population lives below the international poverty line, and about 13% of the population lives in extreme poverty. Among the indigenous groups, poverty averages about 73%, and 22% of the indigenous population are living in extreme poverty. It has the highest birth rate in Central America, with the indigenous at 6.2 children and the Ladinos at 4.2 children. And about 50% of children under 5 years old are chronically malnourished. 70% of the indigenous children are malnourished. So you can see that there's quite a disproportionate number of the indigenous children who are suffering. In the home, many Mayan women work as housekeepers or domesticas for the Ladino families, and that's even if the Ladino family is not wealthy. They don't have to be wealthy. The literacy rate is approximately 70%, with far lower numbers in the Maya. And looking at the women of the Mayan culture, the literacy rate is about 30%. And I think that number is a little high. In many of the rural areas, there's no health care at all, so while we do want to be doing, we'll talk a little bit later about sustainability, however, there is no health care in many of the villages that we've been to. The girls tend to marry young, typically 15 to 17 years old, sometimes younger. Often they've had no education as to what's going to be happening once they marry. Sexually, many parents avoid the topic. And I don't know if any of you read in the New York Times the article on child brides, but Peyton was spoken of there, has the highest rate of maternal mortality in Guatemala at 172 deaths for every 100,000 births. And the infant mortality is also high at 40 deaths per every 1,000 births. And when we think about these very young girls, sometimes 12 years old, their bodies are not physically prepared to be carrying a baby and delivering a baby. So there is quite danger in them becoming pregnant and delivering a baby. So some of the projects that we've been doing, again, just focusing on Guatemala, are relating to child nutrition, oral and dental health, diabetes and hypertension, and in women's health. So when we're down there, it's usually for about a week, and this is a couple of times a year. We do see over 200 children. Assessments are made of their height and their weight, what they're eating, dental health, and we really do focus on the family as a unit. And again, though, oftentimes it's the older sisters who are about 10 years old bringing the rest of their brothers and sisters for care, and evaluating what is going on with them nutritionally as well as medically. So stunting, child malnutrition in Guatemala, it affects almost 180 million children all over the world. And although most of these children who suffer from stunting are in sub-Saharan Africa, South and Central Asia, Guatemala actually has the worst rate in the Western Hemisphere. So if you look at the map and you see all the red of the very severe stunting over on the other side of the world, when you look over at our side, there's this tiny little red country, and that's Guatemala. Okay, it has the worst rate in the Western Hemisphere. Up to 70% of children in rural Mayan villages are affected. And in the long term, malnutrition costs developing countries about $30 billion per year through lost productivity is just one aspect of that. And the picture here is one of our doctoral students with one of our undergrad students who are measuring the child. So this is just a picture of what you can see, that tiny little red country up there is Guatemala. So we wanted to make sure that we were speaking correctly and that we wanted to be able to offer things to the villages that we do go to. So the best way to do that, of course, is you need to do an assessment. So we did this anthropometric indicators we used the World Health Organization's measurements. We looked at these 2 Mayan villages that we go to twice a year, measuring the height, age, and weight. And again, we used standard guidelines by World Health Organizations. So just some initial results from this. This was one of my doctoral students' works to look at. And you can see that I won't bore you with the whole thing, but when you look over in the far column, the percent of stunting was significant all the way down, in particular in the 2 to 3-year-old age groups, 77.5%, 9 through 11-year-olds, 66%, and look at the 15 to 17%, it was over 88. So quite a bit of stunting, even from what we saw in 2 villages. Just to give you an idea of some of the types of things that we see and treat while we're there, the common pathology, respiratory, children come in with a cough. We're looking to see if it's a chronic cough versus acute, but again, remembering that there's open fire pits right in the little huts that they live in, oftentimes with no ventilation. So there are people down there now working to make ventilation in those, but that trapping air in there. So skin lesions. So in addition to the insect bites, fleas, scabies, and lice, and fungal, there's dry skin, there's burns from those open fire pits as well. So we wanted to look at what we were also offering our students, and you can see that the top coding diagnosis in the United States are related to routine child care and sore throats and earaches and vaccinations, viral things, feeding problems, fever. And you can look at our top presenting symptoms that people bring their children to see us in Guatemala, and it's cough, respiratory symptoms, some skin issues, fevers, checkups. So there is a lot of similarity in what they come to see us about. We have in the past worked with some feeding centers. There are new feeding centers being brought up, so this is where the children are still living with their families. However, because of the chronic malnutrition, they are brought to this is an organization that has put together this feeding center so that the children can come once a day and get a decent meal. And I'm going to let Michelle talk about some of our other initiatives.
Thank you. And just going back to the feeding center as Campos de Sueños, what's really interesting, they feed 500 children a day. So it is an incredible amount of children. I have never seen something more organized with a lot of little children, so it's quite impressive. But water is another area of concern for us, and we heard about that a little bit earlier today, but water in Guatemala is often not available, so improved water sources are a big concern for the population in Guatemala. You can see the picture to the left. This is where the children primarily are the individuals who go to seek water. They go down to that public watering area, they fill up those barrels, those containers, and they bring them back to their home. And this is within the home. The picture to the right is where they store their water. That water is easily contaminated by fecal material from their farm animals that live within the same confines of their home. So just looking at what does global water scarcity mean, it's identified in the World Health Organization and within the Millennial Goals as a major effort to help improve water sources amongst these communities. So at Sacred Heart University, we collaborated, and a lot of the work we do, I would say all of the work we do, is a collaboration with the municipalities. So the local governments, we work with them to try to improve the health care and the health outcomes of individuals. We worked with them to have a water filtration project. The girl on the left, she's very proud because that is the water filter that she just received from us. They cost about $50. We raise money, we go down, we teach them how to use their filters, maintain their filters, and how this will help to decrease the disease burden that these children and their families will experience. Otherwise, the children are getting water from sources to the right. So when we went, we collaborated with a local church in Ridgefield, Connecticut, who was great with fundraising, and with Iglesia del Camino, which is in Antigua, Guatemala, and we worked together to deliver these water filters to these communities. And just going back, we go back and a year after year, twice a year when we're there, we go back to evaluate how they are using these water filters. Do they have any questions? Do any parts break? How are you managing the water filter? And not only are they assessed those 2 times when we're there, but we have community partners who also are available and check in with those families to make sure the water filter is working well for them. Another little topic that we do is oral health. We teach the children how to brush their teeth, which was really interesting because many of the children that we saw down there had dental caries that were quite severe. And here you see one of our students teaching the children how to brush their teeth. And we collaborate with a local dentistry organization who goes down several times a year. So when we see a child who has severe dental caries, we then refer them to this organization that will take care of the dental caries free of charge. It was an aha moment for some of us as faculty because for many years we were bringing down toothbrushes and toothpaste for these individuals and they were so anxious to receive them. When finally we decided to start educating them and we realized they didn't even know how to hold the toothbrush or put the toothpaste on. So it certainly was an aha moment for even those of us who thought that this basic skill that we take for granted here in the United States that children would know, but we realized that they didn't. So we started from scratch. And this was the first time we actually taught them how to brush their teeth. We didn't have a running water source, so we actually had a bucket in the middle, a spit bucket. So we had a bucket of clean water and then a bucket where after they brushed their teeth, they would spit in that bucket and we'd get rid of it. But then we were fortunate enough to have Campos de Sueños, the feeding center, have running water, filtered water, so we could teach them how to brush their teeth without having to utilize this method. Just talking about women's health, when we talk about children's health, we want to make sure that the women are healthy because that's the primary. Having a healthy mother will help have a healthy child. So we're really concerned about that, and we include them in our education and in our evaluations. So we do prenatal education and screening. My colleagues are coming back today from Guatemala, and we performed a community assessment in one of the local communities, the Pastores, to ask them, the women, what they wanted from healthcare. Based on that, we presented our findings to the mayor of that town, who identified his top 3 priorities. And one of the top priorities was to have women and children have assessments and evaluations. So they were accomplishing that this week. I'm anxious to hear about their findings when they return. Sustainability, this is one of our partners right here, Mario. He is an American missionary. He was also a Marine from the United States, and he's wonderful. He lives down in Guatemala, and he's one of the community partners who lives in the community. We work very closely with him to have sustainability, providing needs assessments, evaluations, and referrals. And of course, this all helps us improve our cultural sensitivity, our cultural awareness, that we are aware of not just the culture and the culture of Guatemala, but we're open to all cultures and being aware that there may be differences, but we should embrace them. And just some of our friends here, some future programs. And thank you. I know we went over a little. Thanks.